We're in luck today, folks. Look what we got here.
First information I want to share with everybody is congratulations on returning to the United States.
And here's Deanne Sandberg right here without the picture because she won't show her face. I wonder why.
What a successful inauguration was last night for those who had a chance to watch it.
I didn't watch any of it. Did anybody watch it? I don't watch that nonsense. Are you kidding me? God. I have nothing but contempt for Biden, but I did vote for him because I couldn't fathom the thought having to watch Orange Man another fucking 4 years. I don't want to see that guy. That show is over. Canceled, okay? Take it on the road, dude.
It was so well done. And
what do you care?
It is a new time.
You're not. No, it's not. So. You're not even an American, and it's not a new time. Nothing has changed for anybody, except the puppet has changed. Nothing has changed. I'm sorry to inform you people, but nothing has changed. Now the oligarchs are putting on this whole show like, oh look, everything has changed. Well, I'm sorry to tell you, nothing has changed. Maybe it will. I have. After 67 years on the planet, I have my doubts that anything will ever change. The hope that we had in the 60s was extinguished when they wiped out Fred Hampton, John Fitzgerald Kennedy, Robert Kennedy, Martin Luther King. They killed all of those people in the 60s to make sure we could have Donald Trump. And now Biden. It's not like Biden is some new character. Biden is Clinton 3.0. Okay, this guy's been around for 50 years.
So, very, very exciting. So, congratulations to everybody.
But I will say one thing. It's good news for the public transportation technocracy. They're going to have an easier time getting money into their fat little pockets now because the Democrats are always good about filling the pockets of the transit technocracy. The Trumpers were the highway technocracy. You know, they go back and forth. Their leaders are not elected. They are selected. Remember that. We don't elect them. They are chosen for us.
Today, we have Dr. Vine scheduled. Right now, she has not joined us yet, so I've just made a decision that we're going to start and get as far along as we can. I've got some updates for folks, and if she joins us, who is really the star of the show today, we'll go as far along as we can. If not, and she's not able to join us or something technologically has come up, then we'll have to reschedule. So we can open up some other general comments as well. So anyhow, we're going to start, and hopefully she will join in with us. If not, we, like the nimble group we are, we'll just... Starting with the update, part of this session today...
Don't say nimble! Don't fucking say that!
Is, again, continuing to learn, as we said before, another couple town halls before, discussing and learning about the whole COVID vaccine. Not only our readiness, which we did last time, but also the state and the country's readiness in terms of supply of vaccine. How do you get it? What are the health impacts, etc. That's we're hoping Dr. Vines joins us here shortly. And
Dr. Vines.
She's just running overtime from another.
Don't ever say nimble, okay? Don't ever do that again.
Myself sometimes. So anyhow, but we are also fortunate to have Sarah Ewing here, who's the senior deputy counsel internally for TriMet, because there may be some legal questions and such and policies that we want to talk about as well. So anyhow, welcome to Sarah, and hopefully welcome to Dr. Vines here just shortly. So just a quick update on COVID. There was, as of yesterday, there were 78 positive cases for us. Again, our thoughts continue to be the employees and their families who've tested positive. So we want to wish them a speedy recovery.
78, but nobody dead.
I think, as we've said many times before, look, we're into the thick of this now at a very acute time. Let's make sure we are all doubling down on all the precautions that are possible to us. You know the drill. Again, hopefully you're bored from hearing it from me, let alone others, as you educate yourself in the community. It's social distancing. It's wearing your mask. Okay. It's washing your hands. You know the
I'm doing
drill.
a video
So
right
again,
now.
I hope you're so bored
What's
from hearing
the
from me
plan?
on this thing.
I'm going to turn the heater off at 10 o'clock.
You're only as good as we practice.
Okay,
So
good deal.
bus barriers are installed
All
in
right,
our
yeah, I'll
whole
be in
fleet.
bed by noon.
There's only a
remote
number in the
and
country that
click
actually
it
have
off
done
just
this.
in case I
We're now one of them. So these
All
are
right.
just extra
Double layer.
precautions, extra
All right.
layers of
Number
risk
one,
reduction.
right?
So it's all about risk
Yeah,
management
number
here
one.
to
Don't
protect our
forget
health,
the
right?
one.
So
Okay, I'll
during
remember.
the last town hall,
All
I
right.
did mention that we're working on a training
Okay, you
program,
turn it off at
that's
10,
required by the
and
Oregon
Just
OHSA
text me that you turned it off.
for all employees related to the specific COVID items.
Yeah, that,
Training that's going to reinforce
And if I
all
don't
the
hear from
work
you, I'll
that we
use the
have
filter.
already done and are doing throughout the pandemic to keep every one of us safe, engaged, and
All
healthy.
right.
Someone sent me the link last night and I was watching it. It's really well done, by the way.
Sorry, I'm get constantly interrupted when I try to do videos, which is why I try to limit my videos because it's never-ending interruptions here.
So I really encourage you to have a look at it. It should be available in the next couple of weeks on TriNet. I do want to give a special shout out to Gaylord Salisbury for helping, and his team for helping coordinate this effort to get those, create these training materials on pretty darn short notice. So thank you, Gaylord. Thank you, team, for that. But please take the time. These are about nuggets. There's a lot you may know, which is wonderful if you do, but you may pick up nuggets that you go, just, you know what, I could maybe do this a little differently or better. So always be willing to learn. The mask outreach, we are, I know I'm going to be signing up for this as well, January 17th, running through February 6th. We're trying to raise awareness for wearing masks on our buses and our train system. So we're not jamming it down people's throats. I know some people have been after me that force them to, wear a mask, and I don't want to have anybody hurt over a $2.50 fare. I don't want to have anybody hurt and assaulted because of a mask either. So,
and he's right. He's right. You can't argue with the logic here. They can't enforce the mask. They can't. They need a cop on every fucking bus. And in case you haven't been paying attention, they have riots every day.
So this is about trying to do the right thing, and let's role model it ourselves. So we're going to be out there, and please, if you haven't signed up, I think they're looking for 300 volunteer spots to be filled. Come join me, come join others. And the person who's to contact on this is Wendy Hudson to get the link to sign up and help. So 1-800-WENDY-HUDSON. No, I just made that up. Please get a hold of Wendy to sign up for your role or slots out there. So thank you. Next topic, one I sure took no pleasure in having to talk about, but I do want to talk about it. Last week, there were some layoffs here, specifically focusing majority in our engineering and construction division that were announced through Steve Witter, the executive director, and through myself. We were able to keep the layoffs to a minimum.
What layoff?
Failure of the Metro bond measure in this past November.
Yeah, let's hear who got laid off.
Frankly, made it just impossible not to have to make some adjustments here.
Well, of course.
We've been trying to manage keeping people employed to the degree possible in these important times. This one with the failure of the bond measure,
has made get rid of that capital project.
Able to do so. So
get them out.
There were 9 positions eliminated, of 8 of which were in the engineering construction division.
Good. We're very sorry, but I'm sure they can get a job in the Biden administration. So go down there, go find Henderson, and say, I'm from TriMet, give me a job. And he'll say, okay, here you go. We got money coming up the asshole when you're in government.
So as part of reviewing it, we did look at, could we reassign folks? Could we look at other positions open, as well as bringing some outside work through consultants that was done outside before inside, etc. So, we were able to do much of that to minimize and keeping it to the impact of 9 in total. 1 was in the public affairs outreach area as well. So, so we are committed to try and help those folks. If there's other positions that reemerge, look, let's get them back in. But if not, if there's other opportunities for folks, we continue to have discussions with even some of our other partners around work that they may, secondments, things of that nature. So more work to be done. But I just wanted to let folks know that these are not easy times, and sometimes these are hard decisions that have to be made. So I wanted to mention this today to everybody. Now, with that, I am delighted. The star of the show, Dr. Vines, thank you for joining us again. I know you've been racing between meetings, as sometimes we all do. I do also want to thank you before we get into it. By the way, we have a ton of questions for you today. So we have been working quietly, as many people have, around when the bell rings for TriMet and transit in this list of priorities, we want to make sure we're ready too. We want to be the star of the class. But I got to tell you, I had the privilege of working on 6 Olympic Games, big Olympic logistics around.
Why do we care about that? Okay, why? This isn't the Olympics. This is goddamn public transportation. Get your ass back to Canada.
And these things are typically messy. And despite everyone's best intents and efforts, I've tried to set the stage of our own team that we're going to have logistic problems, and there'll be challenges where things don't go always as planned. So we need to stay nimble and humble and flexible while we manage the supply chain when our time comes. So, but we want to be as ready as we can to support all your good work. And I do want to thank you personally for your personal leadership through this uniquely challenging time. These take tolls on people, and yes, doctors and general managers and others, we're human beings too.
Let's look it up.
But I do want to reach out and thank you on behalf of everybody here at TriMet. You've been doing a great job leading us through the state and at this county level. So a big thanks to you for your personal leadership and your partnership. This is the second time you're coming back in your busy world as well. So thank you for carving a piece of your world and sharing it with us. So today, we got a whole lot of questions, Dr. Vines. I don't know if there's any comments you would like to make first, and then I'm going to turn it right over to Deanne Sanders let's get through the questions as best we can. So welcome. Thank you for freeing up the time, and I'll just turn it over to you if there's any opening things you would like to update us on. And then we got lots of Q&A for you.
Sure. Yeah, great. Thank you so much for that warm welcome. It's great to be back with you. I can't believe I was on a town hall with you almost a year ago when this virus first emerged, and now we're talking about vaccine. So thrilled to be here. As you all know, TriMet has a very special place in my heart. I've been an active commuter pretty much since I started my working life in the Portland metro area. And I think it's what makes Portland so great. So anyway, I'm thrilled to be here. I will do my best to answer your questions. I'm ready with some that are very common. I'm ready for the questions that everyone wants to know, which is when will it be my turn? And I think with that, I'd say let's just jump in, and I'll turn it over to Deanne.
Right, we are ready. Hopefully you have like some water nearby and you can keep hydrated and tell me to slow down if I'm going too fast. Okay. So there are 2 vaccines currently available in the U.S., and they both use something called messenger RNA. Can you help us understand what that is, and is it better or different than regular vaccines like the flu shot?
Yeah, great starter question. So messenger RNA is a new vaccine technology. So there are no other vaccines that you would have gotten in childhood or in your adulthood that is based on this technology. The M is the most important part. It stands for messenger. And what messenger RNA is a set of instructions for the body cell's protein-making machinery. So the way these 2 vaccines work is they have this messenger RNA that goes into a little tiny bubble of fat so that your body cells recognize it and take it up. It uses your body's cell machinery to make proteins. And the specific set of instructions it carries are to make a protein that look like a very important protein on the COVID-19 virus. So it does not mix with your body's DNA. It does not change your body's DNA, but it uses your body cells to make a protein that then your body's immune system cells look at and prepare for. And they prepare for it with antibodies. They prepare for it through other types of cells that have long-term immune memory. And so it seems to be very, very effective based on studies. And this was a technology that was already kind of in the wings as potentially really good for vaccine, which is part of the reason why they were able to roll it out so quickly. And if you want more detail, I can give more detail about that. But that's the short answer of what messenger RNA is.
I trust it.
All right, wonderful. So I think number one question for folks are, what are the typical side effects for these vaccines? What's the science around this topic? What's the list of side effects? There's side effects with the first dose versus the second dose. And maybe, how did those compare to what we all know, which is a flu shot?
Yep. So the side effects for the two are strikingly similar, which is why we often talk about both vaccines sort of together when we talk about how effective they are and how safe they are, because they have very, very similar profiles. And what we talk about as the common side effects are really actually, we should call them expected effects. So the expected effects are some pain at the site of the injection. You can get some swelling. Some people get redness. It can stay tender for a few days after vaccine. Some people will get sort of muscle aches. They'll feel unusually tired. They may get a headache. A small number of people will get fever and chills. These side effects are more prominent and more common after the second dose. And the reason I call them expected effects is that these are actually signs that your body's immune system is responding to the vaccine. So they can be uncomfortable, but they generally go away by themselves within a day or so. The more rare side effect that's getting more attention is severe allergic reactions, also known as anaphylaxis, which is typically an immediate life-threatening reaction to something that your body sees that it does not like, and it can make your throat swell. It can give you itchy hives, and again, it usually happens quickly. So these types of reactions are rare. People who have had a reaction like this in the past to something else or to an ingredient in the vaccine, they're available online. I can post the link in the chat where the ingredients are listed, which I would be astounded if anybody knew they had a severe allergy to these ingredients, but it's possible, and certainly people have severe allergies to other types of things. So those people are considered at a bit higher risk for these severe reactions. So these are the people who are asked to wait for 30 minutes of observation following a vaccine. Everybody else, as a precaution, is asked to wait for 15 minutes after the vaccine. And to my knowledge, these reactions, they have occurred. People have gotten immediate treatment, which is a medicine called epinephrine or an EpiPen, and they've gotten immediate medical attention. And to the best of my knowledge, they've all recovered, no problem.
Okay.
Excuse me. I'm sorry. I should add one more thing. Yeah, sorry. I should add one more thing. So these vaccines are recently approved. So if there is a really rare side effect that, for example, happens in only one in a million people or more rare, that will not be detected until enough people are vaccinated, and we have systems in place to find those reactions and those problems and study them and see if they are in fact linked to the vaccine. So kind of my final point of transparency is that if there's a very rare side effect, that information may emerge as more people get vaccinated and we detect that.
Okay. You may have answered some of these next series of questions, so if so, no worries. So there are multiple vaccines. Is one more safe than the other in terms of side effects, or more effective?
Yeah, so I can talk, again, we talk about these vaccines together because they're the same technology. And like I said, they have very similar profiles in terms of safety and effectiveness. I can briefly touch on the differences. So we talk about Pfizer and Moderna, and those are named after the companies that made them. The differences between them are few. So Pfizer is approved for ages 16 and over, Moderna for age 18 and over, and that's just because of how they designed their studies. Pfizer is the one that has to be super frozen at really low temperatures, and that's why there are just a few sites that can receive and store the Pfizer vaccine, even though it can be transported and distributed elsewhere. The Moderna also has to be kept really cold, but not that same deep freeze. And those are really the main differences between them. They're not considered interchangeable, though. So they're both 2 doses. The Pfizer is 3 weeks apart. The Moderna is 4 weeks apart. There's some wiggle room there. And the recommendation for now is not to mix and match. So whichever dose you get as your first dose, you want to get that same brand for your second dose, as close to the second dose timing recommendation as possible.
Okay.
Dr. Vines, can I just ask, just to follow up on this, if I could, as it relates to TriMet, do you have a sense of which one we will be getting when our time comes? Is that known yet, or is it just?
I cannot predict that at this point. We can get into vaccine timing and prioritization. I'll tell you out of the gates, I think it's going to be a while before individuals, by virtue of working in public transit, are next up for vaccine. I think it's going to be on the order of months is my best guess. That all depends on how quickly these vaccine doses come out, how the federal administration distributes them, and how the state decides on its prioritization scheme. And that gets decided at the state, and that gets kind of handed to counties along with our allocation of vaccine.
Is that assuming that Moderna and Pfizer will continue to be the primary suppliers? Or I'm just curious where Johnson & Johnson and others may be fitting into the supply side.
Yeah, so everything right now is based on the Moderna and Pfizer. You're right that there is another vaccine in the pipeline. It's a little bit different and has a little different profile. I'm not aware that its approval is imminent, but once that becomes part of the mix, then there will be an even more complicated conversation about who should get which vaccine and when.
Okay, so the next question was about anaphylaxis, and you addressed that. I'm assuming that if someone would not have an anaphylaxis reaction to the vaccine if they had not already.
No, I'm way off with employee. It's not 3,000 people that work there. It's, according to this, is only 1,240. Well, that's wrong, because I know that's just the amount of bus drivers. So I don't know. I imagine it's 2,000 employees altogether. That's what my guess is. It's not 3,000. How old is this report here that I'm looking at?
Reaction to something else. So you would know whether you're potentially going to have that reaction. Is that accurate?
So people who have had any type of anaphylactic reaction in the past, these are the ones who are asked to wait for 30 minutes. For the rare individual who can actually look at these vaccine ingredients and say, I know I have had a severe reaction to this particular ingredient, they should not get the vaccine. But I would imagine that scenario is extremely rare. So essentially anyone is a candidate for the... According
to this list, TriMet is number 74 in size of employers in Oregon, which is not very big.
First vaccine. The observation period is 30 minutes for people who have had a severe anaphylactic reaction in the past. Anything can happen. So it doesn't mean just because you haven't had a prior history of anaphylaxis doesn't mean it can't happen with the vaccine, but it is rare. And so again, the 15 minutes is a precaution for everybody. And then the 30 minutes is for those who have the same history. And all vaccine sites are prepared with the epinephrine and safety plans for that to happen. So the only people who really can't get the vaccine are the ones who get dose 1 and have this kind of severe reaction, and anyone who somehow knows that they have a severe reaction to one of the ingredients in the vaccine. And again, I'm happy to share the publicly available list of ingredients.
Yeah, that would be great, and we'll definitely post that when we do our recap of this town hall, et cetera, so everybody will have that link. So communities of color have been disproportionately impacted by COVID, and there's a history of racism in medicine. Why should communities of color trust this vaccine?
That is a totally fair question. There's a long history of racism in medicine. There's a history of racism in public health. And that is a history of racism in every aspect of our life. Color who have both suffered from neglect from the medical and public health establishments, and in some cases, abuse and exploitation. So I just want to be really honest about that. There's no question that this pandemic has disproportionately affected people of color. So our Latinx community, African American, Asian Pacific Islander, Indigenous have been overrepresented from what you would expect based on how much of the population they make up. They've been overrepresented in cases and hospitalizations. And so like anything, or I should say like many things.
It's almost like Hitler, the perfect thing that Hitler would invent, a virus that will only take out minority populations. I wonder if there's any basis in fact to something like that. Nah, Hitler's dead and the Nazis lost, right?
This pandemic has laid bare the impact of racism in health in particular. So I should say I'm not trying to sell the vaccine to anybody. I don't own stock in these companies. My job is to give information. What I can share for people who pose this question is there was attention on representation of Black, Indigenous, and people of color representation in the vaccine trials. So there was anywhere between 30 and 40% in rough numbers of people who identified as people of color who participated in the vaccine trials. And so they are a significant chunk of what we know about the vaccine's safety and effectiveness. I should also emphasize that getting vaccinated is voluntary. And I would encourage anyone who is thinking, no, there's no way I'm going to get vaccinated. I would urge you to turn that into a not yet, if possible.
Not yet. We'll wait. Because we don't have any, they haven't tested this. COVID itself hasn't even been around for a year yet. And they all of a sudden have a vaccine they think is going to work. I don't know. I mean, let's look at the facts. I mean, how many vaccines have been, I mean, I've been reading stories of vaccine being suspended in certain places. Vaccines take years to develop. And this one has developed in less than a year, just a matter of months.
Because I think these vaccines do hold a lot of promise based on what we know about them right now.
Okay. So question about the people from group 1A, like doctors and nurses. Have people needed to take a day off after the vaccine due to side effects? Is that common?
Yeah, so those kind of sort of all over body side effects are more common after the second dose. And again, we call them side effects, but they are expected effects of your body's immune response. So there is some planning in healthcare around staggering the vaccine timing for like specialized teams, for example, in case people do feel crummy and like they need to call out 1 or 2 days following their vaccine. Other places have used strategies like trying to vaccinate people on a Friday, knowing that they'll have Saturday and Sunday to recover from any potential side effects.
Get to work.
I'm not aware, broadly speaking, and I'm not sure. I'm not sure we just have had enough experience yet. I'm not sure of widespread need to take time away from work.
Get to work, you fucking slave!
Dose of vaccine, but it is something to account.
Get to work.
For in your planning, especially for like very, very specialized teams where you wouldn't want everybody feeling poorly necessarily on the same schedule.
Great. If you've tested positive for COVID, should you still get the vaccine?
The death rate from COVID is 3% at the highest. Okay, at 3%. So it's not killing millions of people. Okay. And from what I've been reading, it kills mostly nursing home people. So, I mean, I don't believe there's so much misinformation and lies spread by our governments that you can't trust anything, and including this. I don't trust this. I don't trust Trump. I don't trust Biden. I don't trust anybody telling us anything. I don't trust any of these people here talking to us because they're all government employees. I don't trust none of this shit.
Yes. As long as you are cleared from your contagious period, so that's typically 10 days after you test positive or 10 days after your symptoms started, and at least a day has passed since you've been feeling better, that is to protect the people vaccinating. So yes, you are still eligible for the vaccine. You should get vaccinated. The early consensus is the vaccine is going to offer you good longer-term protection, probably, compared to any natural immunity from an infection from the real thing.
So we talked a little bit about folks who might have allergic reactions to the components and people who have had
Why would I?
anaphylactic reactions as well. Are there other folks who should not get the vaccine? What about pregnant women, children? I believe that there's some age restrictions with each vaccine, etc.
23 elderly patients died in Norway after getting the vaccine. And the World Health Organization said Friday that it still recommends the use of Pfizer BioNTech COVID-19. Implicating it found no evidence of causing the deaths of elderly people in Norway after they got the shot and they died. Oh, yeah, it had no evidence of a connection. Right. I don't trust any of this. None. I don't trust any of these people. I just don't trust any of it. I'm sorry.
Yeah, so certainly, so children, there is no approved vaccine for children at this point. Again, Pfizer is approved for age 16 and over, Moderna for age 18 and over. For people who are pregnant or who are breastfeeding, it is a personal decision. That is based on scientist consensus or expert knowledge, belief that this mRNA, it actually just kind of breaks apart after it's used to make the protein, like I described earlier. That's actually why it needs to be held at such cold temperatures, is that it just kind of gets shredded and recycled by your body. So given that, experts think it doesn't pass through to affect the baby during pregnancy, they don't think it passes through breast milk for people who are breastfeeding, but it hasn't been studied. So this becomes a personal decision for individuals in those circumstances based on their risk of being exposed and getting COVID-19. And there's some early data that pregnant women who get COVID-19 may have worse outcomes.
I suggest you check the Corbett report. Google the future of vaccines Corbett report. I suggest you listen to this broadcast or read it. CorbettReport.com, episode 392. It's been banned on YouTube, by the way, which should tell you something right there.
Of their pregnancies, but again, that's really early. So this becomes, I think, a personal decision based on someone's risk of COVID and the risks they're willing to accept from a vaccine that hasn't been expressly studied in those groups.
Dr. Ryan, I just wanted to follow up if I could, is, you talked earlier about the significant temperature for Pfizer. Do you have a read on how many doses are getting thrown out because they can't get administered?
Yeah,
and if that is significant, is there a way for TriMet to be on call, to be available if we put our own champion approach to this thing in?
All right, we're going to stop here because it's getting late. I'm on the East Coast. I'll pick it up again tomorrow.